further complicated by what seems to be a new dispute with the United States. President Donald Trump has ordered American-based 3M to stop sending much-needed protective masks north of the border and even out of the United States entirely. The Prime Minister says he hopes to speak to Trump about that decision in the coming days, but there is no doubt it is making an already challenging task even more difficult, certainly. We also know that tomorrow is the first day for Canadians to begin registering online for the emergency benefit. That starts tomorrow, and many people anxiously awaiting that. The government confirmed yesterday that 1 million employment insurance claims have been filed and now processed. So that has been done at an extraordinary speed as well. As we wait for the Prime Minister, let me bring in my colleague, David Cochrane. He joins us, of course, here from Ottawa as well. David, let's start with the mask issue because it took up a lot of space yesterday, and it continues, obviously, to be an issue that is being worked on behind the scenes. For people that haven't followed the ins and outs of it, just bring them up to speed on what the president is saying and why he's trying to limit these masks.
Yeah, we've always known that Donald Trump as a president is a fairly protectionist guy when it comes to trade and talks about free trade, but really it's all on his terms. And now he's put restrictions around the export of medically essential equipment out of the United States using the Defense Procurement Act or Defense Production Act in the United States to more or less order 3M, one of the big global manufacturers of this necessary medical equipment like N95 respirator masks, not to send anything it makes abroad. Now, the issue with that, as 3M has pointed out, is that their supply chains are integrated. They have subsidiaries all around the world, and they rely on raw materials from other countries, and America also gets medical supplies from other countries. So starting a war on this front ends up hurting absolutely everybody. We know that the Canadian government has been working furiously behind the scenes to try to convince the U.S. administration to change its mind on this, to ensure that Canada and the United States continue to have as much N95s and other medical equipment as it can possibly get. I hesitate to say as much as it needs because the need is so dire and so great right now. And what we know is the Prime Minister is going to be asked about this today, obviously. I'm told, though, that there is no big news to break on this yet. They've kind of adopted an approach, Rosie, very similar to what they did during the NAFTA negotiations, where every single cabinet minister reaches out to their counterparts. Premiers are reaching out to governors and also senior administration officials and trade officials. Doug Ford reaching out to Robert Lighthizer, for example, who's a senior trade official in the Trump administration, trying to convince them of the folly of this particular on a humanitarian level and also in a self-interest level, which may be the more compelling argument for this administration. There is yet, as of yet, no scheduled conversation between the Prime Minister and the President. One thing I'm aware of is that the Canadian government is trying very hard to avoid getting into sort of a bargaining situation directly with Trump. Sort of they don't get drawn into a COVID pro quo as he seeks something from them in return for him moving on his position. They're trying to appeal to the reason of the U.S. administration that what they're doing is unreasonable and is going to hurt both countries when medical supplies and medical personnel are just flowing back and forth across the border at such a significant rate in a time of great crisis.
We know that Canada is set to receive millions of masks in the next 2 days or so, but these are surgical masks, not the masks that you're talking about. So the simpler masks still needed, but not the same. Canada also now says that it has secured a warehouse in China so that we can put stuff there and store stuff there, because we've heard about these ongoing bidding wars. You mentioned a little bit the back and forth here that could happen. The Prime Minister has not, I don't think he's thrown down the hammer in terms of retaliation, but it is fair to say, David, that the government knows what kinds of things what levers could be pulled if they had to go down that road.
Yeah, I think there's two things there. One, I don't think Canada, given the way the government has approached this and just the way this country functions, as a free trade, globalist sort of country, believes in helping other countries, wants to do anything to exacerbate the humanitarian crisis that any country is going through by engaging in a trade war that would cut off critical supplies. For example, we have a pulp mill in British Columbia that feeds about 90% of the necessary raw materials for another company that makes badly needed masks. You want to retaliate, you cut off the supply of raw materials so the U.S. can't make the mask it needs, and then it's a race to the bottom as the body count goes up. So they're eager to avoid that, and also aware of the fact that we may have things we can do to the Americans, but no one in the world is bigger or more powerful than the United States when it comes to economic power and economic retaliation. And this president in an election cycle with lives on the line, you just don't know where that is going to go. So
right.
Canada is trying to work behind the scenes to find a cooperative and a mutually beneficial resolution to all of this, because the global supply chains are fierce. The competition, as you say, in China is basically insane right now, with people offering cash on the tarmac to divert goods from one country to another country. I read a story in the Chicago Sun-Times the weekend, Rosie, where one of the top financial officials of the state of Illinois raced up the highway with a $3.5 million check to meet a guy in a McDonald's parking lot to give him the money for a shipment of masks that this person had obtained through a middleman from China. So it's that kind of situation, the Wild West on the markets right now. A simplified, negotiated, common supply chain is in the best interest of absolutely everybody if you can get to that point.
Okay, David, thank you for that. We'll be back to you after the Prime Minister, of course. That is the shot of the Prime Minister's front door at Rideau Cottage here in the nation's capital. He will speak in about 10 minutes' time or so. Let me go to our colleague CBC's Paul Hunter. He is in Washington just to get the flip side of this story because the President, I don't think he's expected to speak today, Paul, but yesterday was again asked about this, this issue of trying to secure equipment for the United States and the United States only, and doesn't seem to be too open to conversations, even though we know that they are happening behind the scenes.
Yeah, I mean, it's a tough time to read Donald Trump. I mean, it has always been thus, but now particularly so. I mean, it wasn't so long ago that they were talking about soldiers up near the Canadian border from here, and that didn't really play out that way. There seemed to be some sense yesterday when Trump was pressed on this that maybe there was some wiggle room or some hedging, but it's just hard to say, you know. Indeed, all the talks will be going on behind closed doors, yada, yada, on the telephone, yada, yada. But nobody knows what he's thinking on this, because it's as if the messaging can change from day to day broadly. I mean, he was under incredible pressure to implement the Defense Production Act, which is what this is all about. And it is certainly in line with his broad thinking of, you know, put America first, make sure this country is sorted first and foremost. But at the same time, he continues to downplay aspects of the severity of this broadly. Bottom line, it's hard to read.
There has been, I know, talk about potentially, you know, obviously the president said about a week ago that people could think that sanctions or restrictions would be lifted by Easter. That hasn't been the case. I now see more conversations with the president suggesting people might be able to go to church for Easter. Again, really complicated and contradictory messaging coming from him and others on face masks, on what you can do. What is the latest in terms of what the president is saying and how people should be acting?
Well, let's look at the U.S. broadly. I mean, here in D.C., it's a ghost town today. I passed probably fewer than half a dozen people on the way to work, while, by the way, I was wearing a mask, as we are now instructed to do whenever we step outside, and keeping my physical distance 100%. Word in this country right now is to get set for a horrifically sad and awful week. Yesterday, Trump said it would be the toughest week yet for the U.S. Many of those who got sick a couple of weeks ago basically are now dying. Meanwhile, most but not all U.S. states have issued stay-at-home orders for, let's say, a month. Those that haven't are today, I want to say they're being told, but it's almost as if they're being begged by health officials to tell their residents to stay home, if not for a month, then at least for a week. In D.C., we're told the next 2 weeks to not even go into grocery stores, Rosie, or pharmacies. The next 7 to 10 days here are not only going to see the death toll mount and mount, but they are critical, we're told, to break in the back of this, to continue to, you know, slow the spread. Stay away from other people is key, as we've been told throughout. All of that said, and even though Trump was more somber than ever about it yesterday, indeed mixed messages from him this weekend, from the notion that he himself won't wear a mask, to the idea, to what you're talking about, that he'd like to see the NFL season begin on time. You know, again, it's complicated trying to square what health officials are saying with what the president is saying. Meanwhile, 300,000 people now infected, more than 8,000 dead, hotspots in New York, Detroit, Louisiana. We're told D.C., Pennsylvania, and Connecticut are in danger of ramping up. And, you know, we heard it day after day as well in New York as it approaches its apex that, you know, they're running out of equipment and medical gear. There's not enough. And to that, Trump still talks about the need being exaggerated by states and cities. Louisiana says it'll run out of ventilators next week. New York is getting ventilators from China. Meanwhile, the country waits. Physical distancing is happening. Anthony Fauci says it is having an effect, but the numbers are going to get worse, Rosie, before they get better.
Okay. CBC's Paul Hunter in Washington. Thanks, Paul. Appreciate it. As Paul gave you the updated numbers in the United States, let me bring them to you for this country. We are now at more than 14,000 cases, more than 274 deaths. Important, though, also to remind you that there are 2,800 cases that are now resolved. So just gives you an overview. And of course, those numbers ever changing and don't paint an accurate picture of what is happening right now, because not everyone obviously is being tested. Before we get to the Prime Minister, I want to go to a community that has been deeply affected over the past number of days. More people at the Six Nations of Grand River have tested positive for COVID-19. The total in that community is now up to 8. And joining me to talk about that is Chief Mark Hill. We've reached him in Ohsweken in Six Nations territory near Brantford, Ontario. Good to see you, Chief.
Good morning. Thank you for having me.
So 8 people in the community now affected. What are you doing to protect them and to protect everybody else?
So most recently, what we've done, and I know we've declared our community emergency on March 12th. And we're at the most extreme measure that we've taken, which is we've now restricted access to our territory, which means that we have entry points coming into our territory. And again, we've done this to Project Protect Our People. We have an amazing emergency response team that is working diligently around the clock. This is just, just one, again, the importance of protecting all of our people.
I know that the government has set aside about $305 million, I believe, for Indigenous communities to make sure you have all the equipment you need. So what is the state of things in your community? Do you have the personal protective equipment? Are there places people can go to self-isolate if they need to?
So we actually, again, that's been an issue since the beginning. I know that's for around the country and the globe. Personal protection equipment along with the swabs and testing. We do have our own assessment center set up in conjunction with our health services and our public health officials. And again, we've done this and also in looking further to an alternative care site to help with the local hospital potential surges that may be coming. And again, our goal is we've received $2.2 million in emergency funding of that from the federal government, but from a population of 27,000 members and roughly about 14,000 on reserve, that 2.2 only goes so far. And so, that's been some of our challenges is, the shortage of equipment and supplies, but also even in turn in regards to the emergency funding.
Sure. I only have about 2 minutes because the Prime Minister is going to come out of his house here and talk to us, Chief. But I know that there are some communities that have contemplated bringing the military in or reservists in if they need that. And the military is certainly happy to do that. Is that something that you need at this stage, or what would be sort of the trigger point for further support for you?
I mean, I think at this point, our community, the way that our community has come together during this crisis is exactly what we need right now, is for each other to continue to protect each other. One of the, also areas of, that we've talked about and as our council is, we have multiple, businesses, one in particular, an enterprise that pays the federal government, hundreds of millions of dollars in excise taxes. So we have literally millions of dollars that leave our territory to pay the federal government. And yet, it's a huge discrepancy when yet we receive such little funding for emergency services when we could be potentially already having this funding.
Last question, how are people doing with the physical distancing? I don't know how big the territory is. I imagine it's pretty big, but are people following those public health directions?
So it was difficult in the beginning, just like anywhere else. But I think now with the seriousness and when we have confirmed cases here, it really hits home. And I think that's now where our community's at is taking the seriousness of this and making sure that they're following these strict protocols.
Okay. Chief Mark Hill of Six Nations of the Grand River, thank you for checking in with us, and we'll, of course, keep us posted on what's happening in the community.
Thank you for having me.
Thank you. Stay healthy. All right. As we stand by and wait for the Prime Minister of Canada to emerge from his home there to give us his daily update on COVID-19, we are expecting him to talk a little bit more about the emergency relief benefit, which will be available starting tomorrow. Remember, that gives you access if you have lost your job for any reason due to the pandemic. You can tap into $2,000 a month. I'll go back to David Cochrane as we wait for the Prime Minister, but may have to cut you off, David, if that happens. Because of the massive increase in the wage subsidy, which went from 10% to 75% and really covers any business now, they don't, I think, expect as many people to apply for this emergency benefit as they had before, because they're hoping that the wage subsidy will do what the benefit was going to do.
Yeah, the difference is, though, the CERB can start putting money in your pocket within a week if you can register tomorrow, and we're still several weeks away from the wage subsidy.
Right.
So depending on how desperate people are, they may apply for one before moving to the other. So there may be a bridging period required. But Rosie, I think very importantly, we're going to find out this week, and I'm going to get this in quickly because I see them coming out, what the country's IT systems are made of. Can they handle the flood of applications? It's going to be a key thing to watch.
Very good point. All right, here is the Prime Minister of Canada.
Tous ceux et celles qui travaillent en fin de semaine. Les camionneurs, les épiciers, les pharmaciens, les professionnels de la santé, comme toujours, merci. Mais aujourd'hui, je veux aussi remercier nos travailleurs agricoles
who are feeding our families. You are going through a particularly difficult time, but it's thanks to you that we have confidence about staying at home. We know we can rely on you to feed our families and our communities, and we greatly appreciate everything that you are doing for us and to support you.
Over the past few weeks, we've all had to make changes to keep each other safe and healthy, and it's a big adjustment. While we still have a lot of work to do, we're making good progress on getting you the support you need as quickly as possible. And that's what I want to start with today. Earlier this week, we announced more details on how you can access the Canada Emergency Response Benefit if you've lost your job or your paycheck. Starting tomorrow, you'll be able to sign up to receive this support by going to canada.ca. If you choose to direct deposit, you will get a first payment within 3 to 5 days. If you choose to receive your benefit by mail, you'll get money within the next 10 days.
Earlier this week, we shared more details on how you can access the Canada Emergency Response Benefit if you've lost your job or your paycheck. Starting tomorrow, you can sign up to receive this support by going to canada.ca. If you choose direct deposit, it will take 3 to 5 days for a first payment. If you choose to receive your benefit by mail, you will get money within 10 days.
Keep your spirits up these days. But one thing that should give us all hope is the way we've come together as a country. Crises such as this one test the limits of our solidarity. And in these difficult times, we've seen businesses step up to help protect our healthcare workers. We've seen doctors and nurses come out of retirement. We've seen people raise money for local food banks, check on their friends, and help our most vulnerable. Many of you may be wondering how you can help, and I want to remind you that the very best thing you can do to fight this pandemic is to follow public health recommendations. Wash your hands and stay at home, except for critical things like getting groceries or medications, and try to make that trip only once a week. And if you do have to go out, keep a safe distance of at least 2 meters with others. That's how you can keep doing your part. But for those of you with specialized skills looking to help our frontline workers, we do want to hear from you. Health Canada is building an inventory of specialized volunteers that provinces and territories can draw on to provide more support to our healthcare workers. This could include tracking cases and tracing contact, as well as collecting and reporting data. If you can help, please sign up online at canada.ca/coronavirus. Applications will be open until April 24th. We're also offering full-time jobs to all reservists in the Canadian Forces. We're contacting reservists across the country to see if they're interested and offering them the same pay and benefits as regular force personnel for the coming months. Bolstering the military's ranks will help offset some of the economic consequences of COVID-19 and ensure that our communities are well supported. Dans cette crise,
in this
chaque
crisis,
geste compte.
every action matters. If you refuse to follow experts' advice, you're not only putting your own life at risk, you're endangering the lives of loved ones, and you are jeopardizing the health of all the members of our society. I'm not saying this to be dramatic. 233 Canadians have lost their lives because of COVID-19. And hundreds of families are now mourning their loss. To those people who are mourning, I want to offer my sincere condolences. You are going through very painful moments, and our thoughts are with you. To come through this crisis, we must all realize the consequences of our actions. If you don't do your part, your fellow citizens will pay the price. But that also works in the other direction. If you do follow the advice of experts, it's your entire community that will benefit. So let's focus on that. Let's continue to do our part. That's how we will come through this time together.
And I want to close today with a message for kids. Thank you all for sending in me your questions over the past few days. Dr. Tam and I had a great time answering those questions this morning. Later today, astronauts Jeremy Hansen and David Saint-Jacques will be on YouTube, so be sure to tune in. David just returned to Earth after spending many months in space, and he knows a thing or two about staying indoors and only talking to friends and family via video conference. I know these are tough times for kids right across the country and indeed around the world. But know that the support you're giving your parents, and all of us as we work through this, the way you're helping out, the way you're focusing on doing your homework and keeping your schoolwork up, and the way you're learning to adapt to this new situation that we will all remember for the rest of our lives. Thank you for everything you guys are doing to keep us getting through this.
I'd just like to close with a message for young people and children. Dr. Tam and I really enjoyed answering all your questions this morning. Thank you. Later today, astronauts Jeremy Hansen and David Saint-Jacques will be on YouTube to talk to you. David has just returned to Earth after spending many months in space, and I know he has a few tips on staying indoors. And he knows what it's like to talk to one's friends on video conference. I know it's hard for children and for young people now. It's tough not to be able to go to school these days, not to be able to see your friends. But all the work that we're doing today and what you do at the dinner table when you're doing your homework, the help that you're giving your parents as we come through this tough time is very much appreciated. And when we come through this together, we will remember. We will remember for the rest of our lives. So thank you for everything you're doing. Please continue to do that good work. Thank you very much, everyone. I'll take your questions now.
On va passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Merci, thank you. The first question is from David Youngren from Reuters. Your line is open. Please go ahead.
Yes, thank you, Prime Minister. If I can switch topic to the temporary foreign workers who are going to be working on Canada's farms, what are the plans to get these 60,000 people to Canada? How's it going?
We understand that our agricultural producers and farmers right across the country rely very much, as well as fish processors and the fisheries industry, rely on temporary foreign workers to make sure that we can feed our country. That has been the way for many, many years, and we are, of course, looking to ensure that we're able to receive temporary foreign workers, that they will be properly quarantined for 2 weeks before they start doing the work that is so necessary for us all. At the same time, we see many, many Canadians out of work who are wanting to help out, students who are looking at opportunities for summer jobs that they might not otherwise have. And we know there are many people interested in helping out in terms of feeding this country. So we're going to be having more to say in the coming days and weeks about how we're going to pull together and make sure that our agricultural producers, our fisheries, our agricultural transformers are going to get the support they need.
We recognize that it's extremely important for our farmers who are working so hard, as well as the fishing industry, to have temporary foreign workers to help out during these seasons. And we do have to bring in foreign workers in order to do that work as they do every single year. We have to ensure that those people are isolated before they actually begin to work on farms across the country. At the same time, I want to say that there are a lot of people, including a lot of young people, who don't know what kind of job they will have this summer, and they may be interested in helping out on a farm or helping out to feed Canadians through this important work. And I do hope that we will be able to find ways together to help our farmers to continue to feed Canada.
Secondly, you're speaking to us every day. The Deputy Prime Minister is either having meetings or speaking to us. Dr. Tam is speaking to us virtually every day. What are you guys doing to prevent burnout? I mean, there's no way you can continue at this pace. Are you drawing up some sort of rota?
We are looking at how we're all going to work through this issue. It takes an adjustment for all of us. I have very much enjoyed my opportunity to speak directly with Canadians every day, and we'll be continuing trying to do it almost every day at least for the foreseeable future. But we also know that it's extremely important for people who are doing important jobs to take time to make sure that they're getting the support they need. I've spoken with our ministers many times about needing to make sure that we're pacing ourselves, because we do know that this situation is going to last a number of weeks, a number of months, and therefore we have to make sure that we're all supporting essential workers, particularly our healthcare workers, our truck drivers, our food delivery people, but it counts for government officials as well.
Thank you. Next question.
Merci, thank you. The next question is from Bruce Campion-Smith from the Toronto Star. Your line is open. Please go ahead.
Prime Minister, good morning. Just wondering if there are any updates on the N95 masks. Just wondering how critical was the 3M production Canada's supply, and you haven't spoken to President Trump yet. Just wondering if that's on the radar and why there's been a delay in that conversation.
We continue to know that we have to get the necessary equipment and PPE to our frontline health workers. There is a global shortage right now where people are trying to get as much as they can, and we are continuing to work with all our traditional suppliers and new suppliers to make sure that we're providing the equipment needed for Canadians. That's why we've ramped up domestic production as well, and look to have the ability to fill all of our needs domestically within the coming weeks. At the same time, the conversations continue with the American administration in terms of solving this issue, because as I've said, both sides of the border benefit tremendously from the flow back and forth of essential supplies and of medical goods and services. And that is the point that we're making to the administration. I am confident that we're going to be able to solve this, and I look forward to speaking with the President in the coming days. We
know how important it is to provide essential equipment to our frontline workers and healthcare workers. And that's why we are working with suppliers right across the world to secure that equipment. And we're quite confident that we will continue to receive that critical equipment from various places in the world. But we are also working specifically with with the United States to try and resolve this issue. We know that it's in the interests of both of our countries to continue to ensure that essential goods and services can continue to flow across the border in both directions. And I think it would be a shame for both of our countries if that were to be interrupted. So we're working in a very constructive manner with the U.S. administration at this time, and I'm looking forward to speaking to President Trump at the appropriate time in the coming days.
As a follow-up, Prime Minister, you referenced it yourself that thousands of university and college students are coming out of school, no immediate prospect of finding summer jobs, and are now worried about tuition and expenses when they return to school in the fall. The agriculture may work for some, but obviously not for those in the cities. I'm just wondering if that's on the government's radar screen. I understand they won't qualify for the emergency benefit, and wondering what other help might be forthcoming.
This is an issue that we are very, very aware of, from modifications to the Canada Summer Job Program to looking at direct support for students. We know that we need to do more for young people as they come out of university and look for projects and ways of securing income this summer. That is something that we are very closely engaged on and should have more to say in the coming days.
We know that for young people who are finishing university and were relying on a job this summer, perhaps in the tourism industry or elsewhere, in order to be able to pay for their studies in the fall, that they are very concerned about how they're going to be able to come through that period. And we are looking very closely at ways that we can help them. We know that this is a real need within our society, and we will be there to support our young people.
Thank you, merci. La question suivante est de Raymond Filion, TVA. À vous la parole.
Good morning, Prime Minister. More than 2 days ago, Mr. Trump made his comments about the infamous masks. Since this is an urgent issue, how is it that you haven't yet been able to speak to President Trump? Is he the one refusing to take your call? No, we are working, just as we always do, at all levels of the U.S. administration. For a number of years now, we have been engaging with the administration on various issues, and we have developed an ability to resolve issues such as this. We are now doing everything we can to resolve this properly, because we know that it is absolutely essential to have the right equipment for our frontline workers.
It has been many years that we've been working now with this particular American administration, and we've developed certain abilities to work with them in the right way. We're continuing to engage constructively with the entire American administration to highlight how important it is that goods flow both ways and continue to flow both ways across our border. We will continue to do the right things to ensure that our frontline workers and our health professionals get the equipment that they so importantly need.
Now, in the midst of a crisis, how would you describe his behavior, the behavior of U.S. President Trump? Well, my job is to work with the Americans, to work with our allies and partners right around the world, to serve Canadians, and to ensure that Canadians have everything that they and that we need. And that's exactly what I will always do.
Thank you. Last question.
Merci, thank you. The next question is from Mark Bonikowski, Sun Media. Please go ahead.
Good morning, Prime Minister. Today is the 484th day that Michael Kovrig and Michael Spavor have been detained arbitrarily in Chinese jails. The last we heard was the Chinese embassy back in March saying that Mr. Spavor was allowed to call his very ill father by telephone, and that they have been given better food to build up their immunity against COVID-19. Have any of your emissaries in Beijing been able to visit them and give us an update on their conditions and well-being?
Thank you for your question. I can assure you that not just our ambassador and embassy in Beijing, but the government of Canada continues to be focused and engaged on bringing these two Canadians home. We recognize the difficulties that Michael Spavor and Michael Kovrig are facing and have faced for a very long time. It continues to be an issue we bring up continually with the Chinese government, and we continue to impress upon them that it is important that they be treated better and indeed that they be released to come home to Canada. And we will continue that work.
But do you have an updated report from our own people on the ground there?
We continue to engage with them as for consular support on an ongoing basis, and I will ensure that there is a further update in the coming days.
Bonjour, Monsieur le Premier ministre, Christian Noël de Radio-Canada.
Radio-Canada, good morning, Mr. Trudeau. Now, the Canadian emergency benefit starts tomorrow, but some people are wondering whether there's any point in working part-time to make $1,500 a month, or should I not stay at home and get my $2,000 a month? What do you say to those workers who are facing that dilemma, and will you change the system? Well, we have taken unprecedented action to help thousands of Canadians who now suddenly find themselves, as no fault of their own, without an income. We want people right across the country to stay at home and not to work unless it's absolutely essential. And for that reason, we had to develop programs very quickly to help as many Canadians as possible. We also recognize that in some industries, some workers may be asking themselves that question. And that's why we are working now to develop other ways to encourage people who are providing essential work to be able to continue that important work at this time. And we know that this is a situation where there isn't a single measure that will work for everyone. But as we move forward, we hear these concerns and we are seeking solutions, and we will continue to work on them.
In moving forward with unprecedented measures to help as many Canadians as possible, we had to move quickly. We recognize that millions of Canadians are suddenly out of work and needed support so that they could stay home, so that they could take care of their families and follow public health directives during this time. That was the priority, and that is why we moved very quickly to get help out to Canadians. We recognize that anytime we're doing big measures like this, there will be gaps, there will be challenges in implementation and unforeseen consequences, and that is why we are working very carefully to ensure that people who are working in essential industries, people who perhaps are facing choices about whether they continue to work or whether they receive the CERB, are able to make the right decision, not just for them, but for our community and our country. These are things we're going to continue to working on, and we'll have more to say in the coming days.
What do you understand about the dilemma of certain industries who are having trouble finding people to come in? Well, at this point, we are talking about the kinds of changes we could bring in to encourage people to stay at work when that is essential work that doesn't reflect the amount of the CERB. But we know that this is a very difficult situation, and we're going to have to work on it. And at this point, we are doing that work to try and resolve that issue.
Prime Minister Janet Silver, Global News. Yesterday, you said millions of masks were en route from China. I'm just looking for a clarification. Were those N95 masks?
There was many of the shipments are a blend of surgical masks and N95 masks. I'm not entirely sure which particular proportion was in that shipment, but we can get the more answers to you soon.
And BC Health Minister Adrian Dix on Friday called on the federal government to be more aggressive with enforcement and screening at the border. Just wondering what steps are being taken on that front.
Well, first of all, we recognize that the a vast majority of Canadians who were stuck overseas have now returned to Canada, and therefore those flights are being reduced, as there still are a number more to come in. But we recognize that there will be fewer and fewer travelers arriving in Canada in the coming days and weeks. But as we continue to move forward, it is going to be extremely important that we continue making sure that everyone isolates, understands that they need to be under quarantine for 2 weeks when they enter Canada in order to not be spreading COVID-19.
Ashley Burke, CBC News. Donald Trump has said that he's starting to move millions of doses of drugs used for autoimmune diseases into an emergency stockpile to make it available to U.S. coronavirus patients. What happens to people in Canada who are cut off from vital drugs they need for other diseases? And do you plan to speak to Trump about this?
We know that it is absolutely essential that people continue to get the essential medications that they need, whether it's related to coronavirus or not. That is why we're working with the Canadian drug industry. We have a significant pharmaceutical industry in Canada to source the things we need, and we're continuing to work with suppliers and partners around the world on the delivery of life-saving drugs that are necessary beyond COVID-19 treatments. We're going to continue to ensure that every step of the way Canadians get the support and the medication that they need.
We recognize that even in the midst of this crisis with coronavirus, there are people who need essential medications to continue to live and have the proper quality of life. We are working with the pharmaceutical industry here in Canada and around the globe to ensure that Canadians continue to have access to the medications they need.
To Trump about this situation in particular, and as well, what's being done behind the scenes to make sure the CRA website doesn't crash tomorrow when it starts processing all of these CERB applications? Can the system handle it?
We are working very hard to ensure that our systems are robust enough to handle the unprecedented demand. There have been discussions around different ways of ensuring that the system is not overloaded, and we will continue to keep Canadians apprised of that. At the same time, yes, I will continue and we will continue to work with the American administration on all issues that matter to Canadians.
We recognize that there is an unprecedented demand on government systems at this time, and that's why we've taken steps to try and counter any possible overloading of the system. But at the same time, we will be monitoring things at every step so that Canadians receive what they need as soon as possible.
Yesterday, President Trump held a press conference and he seemed to give contradictory remarks on 3M. He said at one point, we need the masks, we don't want other people to have them. He then went on to say that 3M could sell masks to other countries. So can you give us a clear understanding of what the United States has told Canada is their policy on the 3M N95 masks?
We continue to work very closely with the American administration on solving this situation. We understand how important it is for goods to continue to flow in both directions over our border. There are essential medical services and supplies that Canadian companies deliver to Americans, and there are essential medical supplies delivered by American companies to Canada. We will continue to work together to ensure that those flows are not interrupted, because it would be harmful to both of our economies and both of our citizens. That is why we continue to work with the Americans on this issue.
When we've asked you about this 3M situation previously, you've referenced the fact that there are many Canadian nurses and doctors who live in Canada but work in the U.S. Yesterday you said that retaliatory threats or retaliation on this is not productive, but I just want to be very clear. Will you at any point ban nurses and doctors who live in Canada to go work in the U.S., or is this just a reminder to President Trump?
I'm not going to engage in hypotheticals. I will say that we will do what is necessary to keep Canadians safe, and we will do it in as constructive a way as possible. That has always been our approach with the Americans, and it has been effective until now, and will continue to be. Nous reconnaissons que nous avons besoin d'assurer la protection des Canadiens.
The protection of all Canadians. and have the necessary equipment for all Canadians. And by working constructively with the Americans, we believe we have a good chance of being able to resolve this issue. I don't think it would be a good thing to harm our neighbors in order to do what we want to do. I think we have to resolve that together. Thank you very much, and have a great Sunday.
All right, and that is the Prime Minister of Canada confirming for all of us that it's Sunday, because who knows at this point. But it is. A couple of bits of news there from the Prime Minister, primarily out today to remind Canadians that that relief fund, that relief benefit rather, is available starting tomorrow. He says that if you sign up to receive it, it's 3 to 5 days. If you're getting direct payment by mail, it's going to be about 10 days. Lots of questions there about whether the system, the Canadian Revenue Agency, will be able to handle what is expected to be a large demand for the benefit. The Prime Minister says that they are prepared, that they've been preparing. Let's bring in the CBC's David Cochrane. He's also here in Ottawa with me. Let's start maybe with that, the emergency benefit, David, because there are so many people keen to get it. We know that more than 2 million people have applied for employment insurance the last time we got an updated number. So a lot of people want that to happen, and it will happen, and they can start doing that tomorrow.
Yeah, and they're asking people to stagger how they apply for this. What I'm looking at here on my computer screen is a tweet from the Prime Minister saying it opens up tomorrow, but they want people, if you're born in January, February, March, to apply tomorrow. If it's April, May, June, Tuesday, July, August, September, Wednesday, October, November, December, Thursday, and then come Friday, Saturday, Sunday of next week, anybody can apply. They want to do that to kind of stagger the system so it doesn't get overwhelmed. Now, our colleague Kathleen Harris tells us she's been speaking with Carla Qualtrow's office, who is sort of running a lot of this behind the scenes, and the Canada Revenue Agency, she tells us, has been doing troubleshooting for the past week to make sure the systems don't be overloaded, and they expect that the process will run smoothly. That's a hope. I mean, they expect that they've done what they can, but who knows how it's actually going to get flooded tomorrow. The other interesting questions about this, Rosie, is sort of the unintended consequences of the way the Canada Emergency Response Benefit has rolled out and the way it was designed. I mean, you're essentially creating a large, wide-scale, universal basic income program on the fly from scratch. And there are cracks in that system. People whose income hasn't completely flatlined but are really suffering may not qualify. People in certain groups may not qualify. And then the questions we heard from our colleague Christiane Noel from Radio Canada about people who work, say, in a grocery store, vital at this point in time, but they have to go to work, they're at some personal risk, and their salary is lower than what they might make through the CERB. So what is the unintended consequence of people who may just beg off work in what we consider to be an essential service now to go on that $2,000 a month income? So these are the challenges with rolling it out, but they have just been rushing out large-scale, multi-billion-dollar programs at about a clip of one a week, simply because that is what the situation has demanded. So we'll get that first clear test tomorrow as people wake up, log on, and try to apply and get the money that they need to make ends meet. And we'll find out pretty quickly, I think, if the system is able to hold.
Well, they were able to process 1 million employment insurance applications over a fairly quick period of time compared to what they usually do. The CRA would normally be doing taxes. They're not doing that. So presumably there's a little capacity there. Just on the thing that you talked about, the notion that an essential worker, someone at a grocery store, might say, I'm going to make more money on the CERB. I got my producer, Phil, to check that, because that to me sounded a little strange too. So you could just quit your job because you don't want to do it and then get the emergency benefit. You actually can't do that. You can't voluntarily quit your job and get the relief benefit. Right. You would then have to go on EI. I understand that people may think that's unfair, but that's what would happen. The other people that fall through the crack, and the Prime Minister was asked about this too, David, is students, because they are not eligible, even though we know what job would they possibly be able to get right now. So it did sound like the government is looking at that and is aware that that is a problem as well.
Yeah, that's something the Prime Minister said he'll have something on in the coming days. We don't know exactly when. I feel like there's only 3 days right now. There's yesterday, today, and tomorrow in the way these new weeks are evolving. Yes. But unlike that grocery store worker, this is such an issue in Quebec, Rosie. Premier Legault has said they need to find a way to get extra money to people in these service industries just to give them that comfort, because, yes, technically you can't quit, but people could find a way if they feel it's to their benefit and they want to reduce that risk. So this is a live issue that they need to deal with going on. Students, yes, and to link that to, Rosie, Rosie. Temporary foreign workers is an issue that the Prime Minister was asked about today, and an issue that came up last week when the Prime Minister, I think it was Thursday night, spoke with the premiers about this. The agriculture sector needs this. The fish processing sector needs this. This is the model, the economic model on which these industries survive in this day and age. There is a political concern about bringing in busloads and plane loads of people from outside the country at a time of wide-scale quarantine and concerns over the spread of disease, and also at a time of acute unemployment and economic need. Now, a lot of these temporary foreign workers work at a wage in a sector that most Canadians would not work in. This is why this program exists. But if there becomes pushback and difficulty in bringing people in, finding a place to house them as it goes through the mandatory 14 weeks and bearing that expense, then you look at issues about supply chain disruption with food and other things like that in the picking and planting seasons that we have to go through in the agricultural sector. The Prime Minister hinting there that maybe students, this might be something they want to do. I don't know. It's a question of how you can mobilize people, where you could move them. People who say live in a large urban center, how easily they could get to an agricultural sector to work in this. These are all big questions to solve. One of many big questions to solve, Rosie, that keep landing on the government's plate during all of this.
Okay, David, thank you for that. I'll be back to you shortly. I should also just point out that there wasn't a lot of clarity given on the ongoing dispute, shall I call it, with the United States on the state of masks, only that the Prime Minister says he still wants to speak to the President in the coming days, and that the two governments continue to engage constructively. It was the very diplomatic language the Prime Minister used around that, but we do know conversations are happening behind the scenes to try and prevent the U.S. administration from shutting down different parts of the supply chain that are required to make these N95 masks. Speaking of masks and things that are needed for healthcare workers, I did want to take some time to get to our next gentleman. Dr. Samir Sina is Director of Geriatrics at the Mount Sinai Health System and University Health Network in Toronto. Good to see you, Doctor.
Thank you, Rosemary.
I saw your tweet, I don't know, one of the many times I woke up last night or when I woke up early this morning, and it did warm my heart a little bit, so I'll show people what you tweeted. You tweeted, "I stopped the car and wept last night. It was after midnight. I was driving home from another 18-hour day at Sinai Health, and then I saw this. Thank you to my city of Toronto and its citizens for these acts of love that are keeping frontline health workers going." So that's what you tweeted. It was after midnight, so I guess I was still awake. What did that mean to you to see that?
It was one of those things where, for all of us who are at the front lines, for me as a geriatrician, where I care for and I've dedicated my life caring for the population that COVID is absolutely brutal for. We're worried. We're worried about each other, our own healthcare colleagues. We're worried about our patients. We're worried about the country, and we haven't seen the worst of it yet. We know that in 2 to 3 weeks, our hospitals are going to be full. We're going to start seeing reports that you're seeing in New York and hopefully not Italy and Spain. And so there's a lot of anxiety, and amongst us, we're trying to continue our routine care and make sure that our regular patients are okay. And we don't want to make mistakes. So we have all of that wearing on us. And so it means that your usual days are twice as long. You're doing a lot more work and you're exhausted and you're tired. And just, again, right up the street are 5 major hospitals with many people like me. And so coming home at the end of a long day and just seeing like an act of love, it was just so lovely.
Well, I'm glad that could bring a smile to your face at a late hour after a long day. You are, as I said, Director of Geriatrics, and you're quite right. So many of the older people in this country are at risk for this. We see it, these breakouts in long-term care centers. It's very troubling. How difficult is it to be looking after some of the most vulnerable at a time like this, knowing that you might not win all of those battles?
We've already lost a number of battles. Every single life that we lose is a potential life that, an infection that you hopefully could have prevented. So the population I'm most worried about right now is we know that the average population, the death rate is about 1% to 2%. So all Canadians in general. But when you start getting into your 60s, 70s, 80s, and 90s, that death rate climbs by 3, 8, 15, 24%. And for those who are living in nursing homes, it's about 1 in 3. So when the virus ripped through that home in Bob Cajun recently, 60 residents, you do the math, 20 are now dead. It's a matter of math, and so the question is, could we have done more to prevent the virus from getting in the home? Can we do more to protect people in these situations for doing that? And so behind the scenes, and not only am I just caring for my regular patients and working with my colleagues to prepare our hospitals and our 8 sites for the care that we'll have to provide mostly to older people affected, but on the side, late at night, early in the day, I'm speaking to the ministers federally, provincially, making sure that we do everything we can to protect those seniors, the over 400,000 who are living in care homes across the country.
What about the idea, and I've heard some people talk about it, about just taking your parents or the older person in your life who might be in one of those centers out, if you can and if they can. What do you think of that notion?
Yeah, I mean, I struck a chord, I know, when Andre Picard in the Globe, wrote an article about this and said, Dr. Sinha, what would you do? And I said, I absolutely would if you could. Mm-hmm. But you know what, for families and individuals who choose to live in a long-term care setting, that's not a light decision. That's usually families who have become exhausted. They can't provide any more care. There's not enough home care available. The care difficulties are too much. And so that's why people have made that difficult choice to be there. And so it wasn't a glib comment, but it's a call to action to say, while we're very much concerned about our hospitals and making sure we have enough vents and all those things, are we doing enough, and can we do even better to protect the 400,000 people who, if all of them get COVID, that means over 100,000 will die, right? So this is the opportunity. So in Ontario, for example, I worked very closely with Minister Fullerton, our Minister of Long-Term Care, and we changed the regulations because there are families, for example, that the Prime Minister was talking about, where people are unemployed. Mm-hmm. And they're saying, I couldn't work and also care for my mom with dementia. But I have families now who are saying, well, I'm unemployed. And you know what? I could actually care for mom, and I know what her needs are. Mm-hmm. They haven't evolved that much. And, if I can take her home. And so what we've done in Ontario, for example, is we said, if you can, and you're prepared for, and you think you can make this work, we'll allow you to take mom out of care during the pandemic, and then you can bring her back in when the pandemic is over, no penalties. And for those people who are at home now saying, you know what, if we got a call today and they say, can mom go in? But right now, we actually have the capacity and the time because we're at home together. If we can have a few more months to care for mom and then wait till the pandemic end, we've also said that if you make that choice to delay entry, you will not be penalized. And that actually improves the capacity in the system right now. Sure. So that, again, with hospitals overflowing, we actually have room.
I just have a couple minutes, Doctor, but what do you want Canadians to hear? Canadians who might not be getting it, Canadians who might be getting tired of it. What would you like them to hear from you?
Ladies and gentlemen, this is not a drill. I wept last night, and I'm working double hours right now because we know what's coming. This is all math. We know that not everybody's been doing the physical distancing that the Prime Minister and our health officials have been asking us to do. Some people are taking this lightly, and please don't, right? I'm working these long hours. All of my colleagues are working these long hours. We know we could die in caring for you. We know that this is not going to be easy. And you know what, right now, the hospital's quiet. We're actually not that busy, but we know 2 weeks from now, my colleagues, we're here and we're ready, but don't disappoint us. We all need to do our part. And please take this seriously.
Anything else that you need us to do to support all of you?
Just look after each other, and don't forget older people out there, especially who are scared, who are isolated, who, because of this physical distancing can't see their loved ones. So if you have an older person in your neighborhood, look out for them. My friends have been great because they know I'm not eating much these days. So, what do I get? I now get a ready-made meal to make sure I eat. So look after your healthcare workers, look after each other. And if you've got a senior in your life, seriously, reach out, don't touch them, but reach out and look out for them too.
Doctor, it's so good of you to make the time when you are working double shifts, you are doing such important work to keep us all healthy and safe and our loved ones healthy and safe. But I appreciate you speaking to people. I do think it makes a difference too. So thank you so much.
Thank you very much, Rosemary.
And thanks for all of your work. Stay healthy, stay safe. All right, good to talk to frontline healthcare workers during this time, because as we all think about what more we should be doing, they make it pretty simple. Stay home, stay healthy, stay safe, reach out for people who might be vulnerable and need a little bit of extra support. Some pretty good advice there from the doctor on the front lines. As we wait for our regular federal briefing, I believe we're going to hear from Dr. Tam and Dr. Noosh today, and no cabinet ministers, but they will give us a picture of how we are doing in fighting the pandemic. Remember, the federal government also says is working on some modeling, some projections that it hopes to be able to share with Canadians over the next couple of days. The Prime Minister reminding all of you, people that have lost your job due to COVID-19, tomorrow you can start applying for that emergency benefit. You can continue watching on CBC News Network and cbc.ca. Hello again, I'm Rosemary Barton. We are standing by to hear from federal health officials about Ottawa's response to the pandemic. The Prime Minister was out at his regular hour, just last hour, where Justin Trudeau unveiled, first of all, a plan to allow reservists in this country to sign up for full military duty at full pay if they are interested. It's part of an effort to try to bolster Canada's armed forces for pandemic-related operations. Trudeau's remarks came on a day that saw the number of Canadian deaths from the virus jumped by just over 20%. He also, the Prime Minister, said that Health Canada is looking for specialized volunteers to help trace contacts and try and find out where the disease is heading. You can find information about all of those things on the government's Corona website, canada.ca/coronavirus. I want to bring back the CBC's David Cochrane here in Ottawa as we wait for, I believe, just the Chief Public Health Officer and her deputy today. There was a good question today, David, to the Prime Minister, and one that I have also been thinking about burnout of government officials and politicians, because if you are briefing journalists every day and you are working behind the scenes doing a million things, that is a real concern as well. All those people also have to stay strong and healthy, and the Prime Minister seemed to acknowledge that they are going to consider that, because he has now on his, I think that was his 20th briefing, 20 or 21st briefing, and he outlasted me. I took a day off yesterday because it is an issue that I think everyone has to be conscious of. People, essential workers, frontline workers, and the people, the public servants and other people that are doing that an amazing amount of work over a very brief period of time. So everyone needs to just think about that, including us. Let's just talk a little bit more about the emergency benefit, just to remind people again what it is and the fact that it starts tomorrow.
Yeah, the application process for it goes live tomorrow. This is the promised date of April 6th, when they said the online portal will be up and ready. And people have essentially, either had to quit their job or can't work and have to look after someone, or have had no income from 14 days. They can apply for this online starting tomorrow, and within 3 to 5 days if it's direct deposit, or 8 to 10 days if it's a check, they'll get $2,000 every 4 weeks for the next 16 weeks. And then I think we'll see where we are as a country. There was a concern when they started all of this whether or not the government's IT system will be able to handle it. I think this is why this benefit has been moved from the EI system to the Canada Revenue Agency system. There's probably a more robust back-end infrastructure there to make it happen, because the last thing the government wants to have happen is this go live tomorrow and then it crashes under the weight of the millions of Canadians who will be signing up to get this benefit.
Sorry, go ahead, David.
No, I'm saying this is the first of a wave of support programs that'll be rolling out. I mean, some people will still get on EI, some people will get this, and at the end of the 16 weeks, they'll move to employment insurance, and we're still waiting on the full fine print details and mechanical rollout of the wage subsidy that's going to go to businesses too. So there's a lot of things coming, and you talk about that burnout factor, a lot of the same people working behind the scenes to get these systems up and running. It is a real concern, I think, and it should be for everybody, including the Prime Minister.
Okay, the wage subsidy, that's the piece I wanted to ask you a little bit more about. 75% of wages sort of backstopped by the federal government. We know that it was probably 6 weeks, I think the finance minister suggested, from the time that it is legislated until the time it gets to businesses. So definitely the CERB, as you suggested earlier, could be a bridge for some people. But we still don't really know when the House is coming back. I haven't had an update on that, and we don't know how quickly this is all going to unfold. I think you have some details.
Yeah, I mean, we don't know when the House is going to come back, and the Prime Minister wasn't asked about that today. We know there are negotiations still ongoing between all of the parties. They can still do the back-end work, right? Draft the legislation, design the payment system, start doing the inputs into how it will work into the computer system. They just don't actually have the authority to press go and start spinning the money out to people until they get legislative authority on this. But if you look at the sheer ambition of the wage subsidy program that they're rolling out, it's the biggest economic response program probably in a half century or more in Canada. They're essentially nationalizing up to 75% of the private sector payrolls in the country to a certain amount because they want to have the government become the pay department for a lot of companies so they can keep their employees intact. They can stay on their benefits programs if they qualify for such things. And then when we get to a point where the social distancing and physical distancing and the economic lockdown restrictions start to ease, companies can come back to life fairly quickly because people are still working for them. So it's up to $847 per week per employee for about 16 weeks with this as well. There is a cap on it, but it's anywhere from 3 to 6 weeks is what the finance department has been saying. I think 6 weeks at the outside, 3 weeks if they can get it up and running that much quicker. And I know from talking to people I know who own small businesses, 3 weeks versus 6 weeks makes a big difference as to whether or not they can stay going or whether they have to go under entirely, rely on things like the CRB, and then try to come back up when that money is actually rolling in, especially as restaurants, for example, adapt to either curbside pickup or takeout only or delivery only, you know, from a sit down and eat model. This is a real challenge for them. And again, the challenge for the government, and going back to that burnout question the Prime Minister was asked, is the Finance Department's rolling out the wage subsidy, it's rolling out the CERB, it's working on tax deferrals and credit facilities, and working with the banks to lower interest rates for people who are in income deferral, or sorry, in interest deferral and payment deferral because of all of this. There are 1,000,001 things happening with a workforce that is working from home, physically distancing themselves from each other, and it becomes a smaller and smaller subset of the government that is working on these things. I mean, one part of the public service we haven't really talked about a lot, Rosie, are the people at Global Affairs Canada who are arranging all of these repatriation flights, working with the airlines, working with countries across time zones and different travel restrictions and airspace closures. Yeah. That is an absolutely massive relief effort. It's like a viral Dunkirk going on a daily basis here in the country.
Good point. Okay, David, thank you for that. And someone on Twitter is asking me what time can we start applying online. I don't know the answer to that. I'm going to get it, and I'll have it for people after that, and we'll tweet it out too. All right, we'll get back to David shortly. Let's go now, though, to Dr. Theresa Tam, Canada's Chief Public Health Officer.
Canada. So there are now 14,426 cases, including 258 deaths. The highest proportion of deaths among those aged 80 or older. So obviously keeping seniors safe is a very critical part of what we need to do. And again, remember that these cases represent previous exposures, but we need to thinking about what the risks are now. This means the best bet is to consider that there could be community spread wherever you are, and always practice physical distancing by keeping a 2-meter distance from others. So Canada has completed over 323,000 tests for people in Canada, and just over 4% of these have been confirmed as positive, and 95% confirmed as negative. Each day, we are adding to our knowledge of COVID-19, keeping pace with the rapid growth of new scientific evidence as it emerges. This has been and continues to be critical to how and when new decisions are taken. There are times we will act with speed over perfection when the price of inaction is high. In other cases, we must wait for the science to catch up while layering up with all the protections that the science has proven time and again to work. So this is why I have been a broken record about tried and true public health measures. We know these work and that they can plank the curve. So we can all get it right. Kids across Canada are asking, what is flattening the curve? They are giving up soccer games and play dates and not going to school to help plank the curve. They are learning about social distancing and hand washing while singing different tunes and doing their part to help slow the spread of the virus. This is great, and we can all do the same. We know that these efforts require sacrifice, so we must undertake them together, taking care to look after one another and also to look after our own physical and mental well-being. COVID-19 has reminded us of both our vulnerability and our interconnectedness. We are stronger together. Thank you.
Bonjour. Comme d'habitude,
good morning. As usual, we'll start with an update on the number of COVID-19 cases in Canada. There are now 14,426 cases of COVID-19, including 258 deaths. Remember, these cases represent previous exposures, but we need to be thinking about risks now. The best thing to do to prevent the spread is practice physical distancing, assuming that there could be community spread, and keeping a 2-meter distance from others. We continue to test at a high rate in Canada, with tests completed for over 323,000 people in Canada. Just over 4% of these people have been confirmed as positive, and 95% confirmed as negative. Each day, we are adding to our knowledge of COVID-19, keeping pace with the rapid growth of new scientific evidence as it emerges. This has been and continues to be critical to how and when new decisions are taken. Waiting for the science can be anxiety-provoking, and there are times when we act with speed over perfection, when the price of inaction is high. In other cases, we must wait for science to catch up while layering up with all the protections that science has proven time and time again to work. And that's why we've been like a broken record about tried and true public health measures, because they are the certainty. We know that they work and that they can plank the curve, if we can all get it right. Kids across the country are asking, what is flattening the curve? They're giving up soccer games and play dates. They're learning about social distancing and hand washing while singing different tunes and doing their part to help slow the spread of the virus. This is great, and we can all do the same. We know that these efforts require sacrifice, so we must undertake them together, taking care to look after one another and also to look after our own physical and mental well-being. COVID-19 has reminded us both of our vulnerability and of our interconnectedness. We are stronger together. Thank you.
Okay, thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics here. Operator, over to you for 2 questions on the line.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. Et s'il vous plaît, appuyez sur étoile 1 pour poser une question. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. La première question de Mia Rabson, the Canadian Press. The first question from Mia Rabson from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I'm wondering if you could talk a little bit more about face masks in terms of, you've said many times that Canada wants to be a lot more like South Korea and Taiwan than let's say, Spain or Italy. But these are countries where they told people to wear face masks quite early on. Are you concerned that not giving that information to Canadians has contributed to the spread in Canada?
So we're always looking at evolving science, but some of the really critical measures is staying home and self-isolation. So whether someone is symptomatic, of course you should stay home. The question of the evolution of science on the how much pre-symptomatic transmission, for example, contributes to the epidemic is still undergoing evolution in terms of the science. However, if people who are meant to be self-isolating, stay at home, if you quarantine, those 14 days are there so that if you become symptomatic, you're already apart from others. So those are absolutely critical measures. Case finding, contact tracing, and social distancing. As I've said yesterday, we are actively reviewing the evidence right now with the provinces and territories. We'll have more specific recommendations in a very short time frame. I did say, though, there are three really critical aspects to our advice to Canadians. One is that right now, medical masks, including surgical and medical procedural face masks, respirators like N95 must be kept for healthcare workers and others providing direct care. Secondly, again, non-medical masks, so these are some of the examples that people have talked about in terms of homemade masks in the community hasn't proven to protect the person wearing it from getting the virus. So everyone must still practice strict hygienic measures and the social distancing measures. Stay home if you're sick. Wearing a non-medical mask is an additional measure that we're considering to protect others around you. So it's a matter of you protecting others. So these are the three key aspects. And what we want to do is to provide thoughtful advice to Canadians so that if they wear a mask, how do you do this properly? And I want to make sure we have good advice on, even amongst homemade masks, how do you do that properly? What materials are appropriate, for example? So all of this is under active discussion right now.
Thank you. One follow-up?
Thank you for that. I'm also wondering if you could talk a little bit about protections for healthcare workers. We've heard in other countries the number of healthcare workers that are falling sick is quite high, and here, without proper protection, seems that those numbers are there. What are you specifically trying to do to prevent those kinds of things from happening here, and why can't we know specifically what the shortage is of masks for healthcare workers?
So protecting healthcare workers is absolute priority. It is of paramount importance. So as we've all been saying, in every stop has been pulled out in terms of getting supplies. And globally, there is a very much a sort of competitive environment and a shortage environment. So we are doing everything that we can, not just getting PPE from overseas, where traditionally that's where they come from, but also the domestic supply. So some of these things are coming online and being delivered. But every day those numbers will change, and depending on the utilization of the mask and the deliveries. But we are also looking at very other measures, such as how can we disinfect, if you like, or decontaminate masks? How do we best look after the limited supply that we have? And many of the other measures, for example, that provinces are taking is ensuring that they designate wards or hospitals just to look after COVID-19 patients. And that also helps the stewardship and the conservation of personal protective equipment, because it'll be one specific area or one specific hospital where patients are being looked after so that they can look after that supply of the PPE. So many, many things are being done to ensure that we protect health workers. And the other thing is, getting a better understanding of the healthcare workers who are infected. I do know that, for example, it's not as simple as people think. Many of healthcare workers were perhaps infected in the community or through travel, and not necessarily through the actual healthcare facility. So you need to actually understand medical officers at the local level is in a very good position to understand the exact reason why healthcare workers have been infected, but also to protect the patients that they are trying to take care of. So that's really critical.
Thank you. Operator, next question on the line.
Thank you. The next question from Philippe Vincent Foisy from Radio-Canada. La prochaine question de Philippe Vincent Foisy de Radio-Canada. Excusez-moi, la prochaine question de Carly Weeks. Philippe Vincent Foisy qui avec la question.
Oui, allô?
Oui,
Yes.
la voix est parole, Monsieur Vincent Foisy.
OK. Monsieur New, la semaine dernière, vous avez répété
Mr. New.
que c'était une semaine critique.
Last week you said it was a critical week.
La semaine est terminée.
Now the week is over.
L'épreuve, est-ce que la semaine critique
Did Canadians do what they needed to do? Was the week, in your opinion, a positive one or negative? Answer. Thank you for your question. It was a critical week last week. This week is a critical week as well. The issue this week as well is the data and what's happening with the data that we're receiving at the federal level. It represents cases of exposure from 2, 3, and 4 weeks back. So there's always an incubation period. Someone then gets sick, seeks a test. There are the stages and the efforts that begin. So these efforts are underway at the municipal level, and it shows that occurs at the provincial level as well. So it's difficult for us to determine precisely if we were successful, but we're monitoring what's happening in the individual provinces and territories, and we're seeing in British Columbia, for example, that health authorities have said that their results are perhaps optimistic, but they're being cautiously optimistic. Nationally, it's more difficult. So I think the most important thing to do at this point is for all Canadians to continue with physical distancing for the next couple of weeks especially. Thank you. Follow-up question.
Votre suivi maintenant?
Oui, je posais la question de suivi.
Yes, follow-up question. With respect to masks, last week the Quebec government said that they needed a couple of million surgical masks, some million N95 masks for Quebec alone, across Canada now. Do you have an indication as to how many masks are required? And can you compare that with the masks that will be coming in for China? Will there be enough? Will it serve us for a couple of days, or how many days will we be covered with the incoming masks? Answer. Thank you for the question. That is another issue. Everyone is working very hard at the federal government level in cooperation with all the provinces and territories, because we have a Team Canada approach. We are placing bulk orders. After that, we have distribution to the provinces and territories based on a framework. We know that there are some outbreak areas in the provinces and territories, and those areas are priority destinations for the PPE. To the areas where the outbreak is more serious. But it's difficult. We can't provide exact figures because the situation is very fluid. With the flights, the distribution, if we give you a figure now, in a few moments or a few hours, it may no longer be the up-to-date figure. So what we can say is that we continue to work in close cooperation. The situation is fluid and evolving day over day, and we're doing our best. Even if we continue to buy what's available on the global market, we're also continuing our efforts to enhance our domestic capacity to build masks, to produce masks here for frontline workers on the ground. Another aspect in Canada is research. We're looking at ways of disinfecting personal protective equipment that's already been used. That may be another way of preserving the equipment we already have in Canada. So we're working on several fronts at the same time on the issue of use and distribution of this equipment across the country.
Thank you. We'll come to the room now for...
Should I repeat in English or?
Sure.
Please. Same question. Obviously, Dr. Tam and I, we've been repeating. It's a very live issue in terms of getting the necessary personal protection equipment for our frontline workers, especially healthcare workers. It's difficult to give exact numbers because it is a very competitive global market. Certainly, we're pulling at all the stops, the federal government in collaboration with the provinces and territories. We have what we call an allocation framework, so that when masks do arrive, there is a mechanism in terms of how we would distribute. Obviously, there are lots of factors in play. For example, if a given part of the country has a specific outbreak or a region that's particularly affected, certainly that would be a priority to get the masks that are available to that specific area. In addition to, obviously, the very competitive global market, we're also looking at increasing our domestic capacity. That won't happen overnight, but certainly efforts are underway to make sure that here in Canada, that we have the capacity down the road, hopefully sooner rather than later, to make, quote, our own personal protective equipment. So that's number two. And then number three, we're also actively with our researchers across the country looking at other ways that maybe we can even reutilize masks, as Dr. Tan was just saying, in terms of disinfecting them so that they can be used again. And that way we can also conserve the PPE we have here in Canada. Thank you.
Thank you. We'll now come to the room for 2 questions. Mackenzie.
Hi, Dr. Tam and Dr. New. Mackenzie Gray from CTV. Dr. Tam, yesterday when I asked you about masks, you said that the main reason why someone who wasn't sick at the point of showing symptoms should wear a mask is to not give droplets to someone else. That, to me, made it sound like there is some science that you've been looking about asymptomatic transmission or pre-symptomatic transmission. Can you speak to what the science is right now? And very specifically on that, in the period before someone shows symptoms, how early are they able to spread COVID?
So we are actually right now going to be reviewing this with the other chief medical officers and in terms of the studies that are available. They are actually limited. So with that, we will still be making some recommendations. What we do know is if you put a swab into someone's nose and throat, you will get the virus identified before someone is symptomatic. So that is a fact that we know about. When does someone transmit? That is the more difficult question. So there has been some studies, some of which are released in the last few days. For example, a study in a long-term care facility in the United States is showing that people who are pre-symptomatic, they will become symptomatic, but maybe 2 days or so. So we're looking at that period, how certain are we about 2 days, 1 to 2 days, 2 to 3 days, looking at that period that they could transmit before they have symptoms. We still believe that people with symptoms is the main force overall for the propagation of the actual outbreak. But in certain settings, as you can imagine, like long-term care, it is really vital to look at that because it can change practice, including the use of PPE, so that staff may not realize that they will become symptomatic, or residences who have many other medical conditions, for example, you can't tell. There are other things that we should be doing as well. So that's the live discussion that we're having, and we will be providing more information on that to come. There's also other laboratory studies where people are made to cough or do other things to see whether they can spread. And so there's different groups of studies that we're looking at right now.
One follow-up?
President Trump has been discussing the anti-malaria drug, and forgive me for the mispronunciation, hydrochloroquine, you two know what I'm talking about, as a potential treatment for this. What is Canada's position on this? Have we used this drug to treat people in Canada at any point during this? And it's also a drug that is used for lupus, according to my understanding. What are we doing to make sure that there is this drug set aside to make sure that people who need it for conditions that we know it'll actually help, to make sure that those drugs are there for them?
That's a very good question. We do not have any specific treatments, and none proven to work for COVID-19. But hydroxychloroquine is one that is being studied. So in Canada, we are part of those studies. So ensuring that we have hydroxychloroquine so that people who use it is part of a clinical trial. So you can get data from them is part of what's going on right now. In terms of absolutely, I think our key message is that we do know this drug works for certain medical conditions. People with certain inflammatory illnesses, some of the immunological illnesses that you've talked about, malaria, prophylaxis, you must preserve those actual indications. So that we are working on that with Health Canada, that's the regulatory authority, with the manufacturers, and there are several of them. Some are manufactured in Canada. So we are monitoring the supply situation and looking to what we need for the purposes of patients who need them and the trials that it needs to be conducted. But it's definitely one on the list of treatments that we are looking at for COVID-19.
Ashley Burke, CBC News. You just mentioned you're monitoring the supply of that specific drug. Can you tell us about how much of it we do have here in Canada, and do we rely on a large bulk of it from the U.S.?
I know that there's several suppliers, and I know that there's domestic manufacturing. So I think I also know that there's a very a great deal of interest globally. So we are very alive to the fact that this supply, which we have, we need to, really, if we need to augment it, there is a domestic capacity to do so. But making sure we have enough of the patients that actually need it for other purposes, I think, is our primary concern right now. And so, but there is, I think, from my perspective at least, we have domestic capacity.
You were just talking about decontaminating and disinfecting masks and that process. Can you give us some more specifics of exactly what type of work you're doing right now on this, where we are at the process and how close we are to actually doing this? As well, what does it signal about our supply here?
So I think it's a multi-layered approach to the supply, and I think everyone is aware that the supply is a very dynamic situation, but there's a lot of need. So this is another method. So part of it is the science of decontamination of what works. And secondly, we are looking at multiple entities in Canada that might be able to actually do this. And also then signaling to provinces and territories that certain things shouldn't be thrown away right now, so that we can actually implement this should we find the actual people who can do this. But I think that is one of the most important and I think worthwhile lines of pursuit for PPE right now.
Thank you. We're going to go to the line for two final questions. Operator, over to you.
Thank you. The next question is from Carly Weeks from the Globe and Mail. La prochaine question de Carly Weeks du Globe and Mail.
Hi, and thank you. Dr. Tam, I was just wondering if you could address something. You said last week this would be a very critical week in terms of cases and numbers. We have heard from officials in BC and to a lesser extent Alberta indicating that they may be seeing a bit of a slowdown. On the contrary, it seems as though the situation in Ontario and Quebec provinces that you singled out last week are accelerating. I was wondering if you could comment on how some of those situations might be evolving and what you're going to be looking for in the week ahead.
Yeah, I think that's actually quite a good summary. We will be looking towards British Columbia and maybe Alberta because they have a very different epidemiology to Quebec and Ontario. I think all chief medical officers are trying to be extremely cautious about what we're looking at because we know the situation can change. And with the delay in terms of what you're seeing right now in terms of numbers, again, is what happened several weeks ago. So that is absolutely important for everyone to know. And as I've said before, you won't know that you've passed a certain peak until you're actually on the other side of it. And it's always very difficult to make any pronunciation on that. So it is a day-by-day look. And so then I do think that Quebec and Ontario, even individually, have different epidemiology and different timing and trajectories. So Quebec's dynamics will be different to that of Ontario, and the timing will be different. So we'll be watching each of these individual provinces very carefully as well. And we think they may have started a bit later than British Columbia in the epidemic as well. So the timing of when we will see the measures, I think, will be a bit different across the country.
Thank you. And one follow-up?
Sure. So maybe looking forward, casting ahead a week or so, how concerned are you if we do continue to see those, particularly those hospitalization and ICU numbers jump the way that they currently are in Ontario and Quebec?
So I think, again, the exposures to those individuals would have happened at least, a couple of weeks ago. So what happens is we do have to look at everything again on a daily basis because I'm aware that each of the jurisdictions have layered on even more additional measures in the meantime. So you will be seeing the impact of what happened like a couple of weeks ago. And then there's even more measures being done since then. And so I think we just got to be able to watch this day by day. But just to really emphasize that what things happen in the next ensuing weeks is dependent on what we do today. So if we don't keep on going and absolutely tighten up our social distancing, self-isolation, case contact measures, that's what's going to impact a couple of weeks down the road. So that is a really important concept that everybody has to grasp. What will happen 2 weeks down the road is what happens today. So it's just a concept that I think Canadians need to be aware of.
Thank you. And one final question on the line.
The next question is from Mo Fahim from Vista Radio. La prochaine question de Mo Fahim de Vista Radio.
Hi, good morning, doctors. My question is regarding, is the federal government considering to emulate how some Eastern countries are providing accommodation for healthcare workers so that they can absolutely minimize any contact between them and people around them? Is the federal government considering anything close to that?
We are looking at everything, basically, to slow down the spread of the virus in this epidemic. And so these are some of the kind of discussions that we do have with provinces and territories. That's a very good question. And if you look at what the provinces are already doing, I'm aware, for example, yesterday Manitoba actually articulated the precise thing that you just described, is making sure health workers, should they need a place to self-isolate, to not just protect themselves, but to protect their families, they're looking at the support for them to do so. So absolutely, that's one aspect of our response that we can offer support for, should that be needed.
Thank you. And one follow-up?
Thank you. I don't have a follow-up. Thank you so much, doctors.
Merci. La séance est maintenant terminée.
That concludes the press conference.
The conference is now ended. Please disconnect your lines at this time.
Daily federal briefing from the Chief Public Health Officer, Dr. Tam, and her deputy, Dr. Nuge, about the state of the pandemic in this country right now. I'll bring in David Cochran, who's been helping me through our coverage this morning on this special. couple of interesting points. Let's start maybe, David, with masks. Not only the lack of, but also the advice on, because it does sound like that is an ongoing conversation.
Yeah, there's a couple of things going on with masks right now. Really, the conversation today is about money, masks, and modeling. But on masks, obviously efforts to get supply as we ramp up to build a domestic supply chain where masks can be manufactured in Canada for Canadian needs with surplus going globally. That's sort of the status we're in right now. Some discussion that the University of Manitoba, researchers there are working with the National Microbiology Lab to try to come up with a process to allow for the disinfectant of N95 masks. That could allow them to be used up to 10 times. There's a good story there on Global News on their webpage about this. And this is something that Dr. Tam has said is an important and worthwhile pursuit in the fight to extend the life and line of PPE material. So that's there's kind of three tracks being pursued. How do we extend the life of the ones that are in use? How do we get more on the global market? And ramping up the domestic industrial capacity of Canada to create a made in Canada supply solution. Then there's the ongoing questions about whether people should wear masks when they go out in public. Not N95 masks, not surgical masks necessarily, but homemade cloth masks, because again, anything that can contain the explosion of droplets that come out of you, should you sneeze or should you cough, is seen as beneficial in maybe reducing community spread, even if you are asymptomatic. This is something that has been part of the effort to attack the virus in jurisdictions that have had some success, in places like Taiwan and in places like Singapore. But again, it is also stacked on top of the aggressive hand washing, the physical distancing, the testing, and the tracing, which you see being done very aggressively in Germany, which has also had some success in dealing with this. Dr. Tam says the science is evolving on this, that more and more people are coming to the conclusion, it seems, that it would be a good idea. I know, Rosie, we have colleagues who are convinced this is a very good idea and that people should be doing this all the time, but they want to make sure that they give people very clear instructions on what materials to use, what design to use, and when and how to use it, and how not to use this as a substitute for all of the other measures that are important for getting to the point where we can flatten the curve as a country. Because as she talked about, as you look at the provincial data, you're seeing some positive signs out of British Columbia and Alberta, some worrying signs in Ontario and Quebec in a week where we're expecting the federal government to release a big national model on all of this.
Right, and just a final point on the mask. The CDC, of course, in the United States has now said, hey, if you want to wear a mask, it might help you. It's not an order, but if you feel like that's something you want to do, you should do that. So they are continuing to speak with her provincial counterparts, and I guess we'll hear more, she says, in a short time. And I just want to make a final point about the emergency relief benefit, because my trusty producer, Phil, did check into when it would open. So everybody that wants access to that relief fund tomorrow, it opens at 6 a.m. Eastern tomorrow. They do want to stagger who is applying when. So if you go on the website and you check your birth month, it will tell you what day you should sign up. If you are eligible for EI, you can apply for through EI and you'll be switched over to the emergency relief benefit if you've already applied for EI. So important information for tomorrow morning. David Cochran, thank you for all your help with our coverage today. Appreciate it very much. Another big piece of news that is going to happen a little bit later today will be when the Queen will address the impact of the COVID-19 pandemic in a televised speech that will happen in a few hours from now. For more on this, I want to bring in the CBC's Dominic Velitis. He's in Bristol in the west of England. Dominic, this is a big deal and it doesn't happen very often.
No, that's quite right, Rosie. It is an extremely rare event for the Queen to make a public address to the British people. I think it's only happened a handful of times, really, during the Queen's 68-year reign. When you look at the history books, we have to go back to the outbreak of the First Gulf War back in 1991. We had an address then. Following that, it was the death of Princess Diana in 1997. And then after that, it was the Queen Mother's funeral in 2003. So it is a very rare event, barring, of course, the annual traditional Christmas message that the Queen gives. It is very rare for her to take this action. We know, Rosie, that the decision was made in close consultation with Downing Street. The timing is significant here. We are about to hit a very grim milestone in terms of the number of deaths here in the UK. We're just a couple of dozen short of hitting 5,000. I suspect by the end of today, we will have reached that. So the timing is significant. What else can I tell you about this? We know that it was recorded is pre-recorded. It was recorded on Thursday at Windsor Castle. She normally spends Easter there, but she arrived about a week ahead of schedule this year, because you may remember, Rosie, that she left London early because of the threat of coronavirus. We also know that this address was filmed by a sole cameraman wearing full protective clothing, and it will be broadcast on several platforms. So it'll be broadcast on television, on radio, and online on the Royal's specific online channels in a few hours from now, a couple of hours from now. But of course, it comes less than a week after Prince Charles, her son, next in line to the throne, left isolation after he was contracted the coronavirus as well. But he is said to be in good health now, Rosie.
We have a little bit of a sense of what she will say in order to, I guess, sort of bolster people and in their, as their their social distancing and self-isolating.
Yeah, that's right. It's kind of been billed as a rallying cry, really, Rosie, a message of unity to the British people, as well as thanking NHS staff and frontline workers. And we are expecting her to acknowledge the grief, the pain, and the financial difficulties that Britons are currently facing. But we know that she's also going to emphasise the role that individuals in society can play to make an impact on this outbreak. We can actually show you now a little taster of what she's going to say. The Palace have given us a short extract. I'll just read that out to you now. She's going to say, "I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say that the Britons of this generation were as strong as any, that the attributes of self-discipline, of quiet, good-humoured resolve, and of fellow feeling still characterise this country." Now, for me, Rosie, the key message in that short extract is a message of resolve and self-discipline. And I can't help but wondering personally if that's not directed towards those people who, unfortunately, here in the UK, are still flouting the rules in terms of social isolation and social distance, rather. So I think that key message is directed towards that. It's been a particular problem again this weekend because we've had some quite fine spring weather here this weekend. And again, police have been making appeals here for people to take the advice to stay indoors, because doing so, they say, protects the NHS and therefore protects lives. And it's got such a point now, Rosie, that the government here is considering now banning exercise outdoors. So that could be the next step that we face here in the United Kingdom in terms of the restrictions that we're all under here. The timing, as I say, is certainly appropriate because we are about to hit this rather grim milestone of 5,000 deaths here in the UK, Rosie.
Okay, Dominic Velitis in Bristol, England today. Thanks, Dominic. Do appreciate it. And of course, we will have special coverage of the Queen's address to her nation and to the Commonwealth, starting at 2:30 Eastern on CBC Television and CBC News Network. The Queen will speak at 3 o'clock Eastern, and we'll bring you that address when it happens, as well as some analysis, because if the Queen is talking about resolve, she certainly embodies that for a lot of people, and we will bring that address to you and talk to you about things that they are doing in England, of course, as Dominic was talking about. The other part of this, and the Prime Minister has alluded to it almost every day that he's spoken to Canadians, is how to deal with kids and getting this message through to your kids. Indeed, he spoke to CBC Kids and answered some questions there. But it's something many people are obviously struggling with, working at home, dealing with your kids. It can be a very fine balancing act between reassuring, communicating, being really honest about what's happening out there. Karen Irwin is a child development and parenting expert. She's in Collingwood, Ontario. She's also the mother of 3 young children who are all there. Hi, Karen. Hi, kids.
Hi, Rosie.
Good to see you all. And Charlie, I think it's your birthday. Charlie.
Is it your birthday?
Yeah. Oh, well, happy birthday. I think you're 3 today. That's big.
Are you 3?
Yeah. Yeah. All right. I'm not super interesting to Charlie, but Karen, tell me. First of all, how are your kids doing? How are you guys all managing with this?
Yeah, we're managing as best we can. Obviously, we have highs and lows, but we just sort of take it day by day, and so far, so good.
What are you telling your kids? What is your best advice to other parents about how to explain all of this? Because you have to, because life is so different.
Yeah, no, so you're right. I think it's really important that parents talk to their kids about what's going on. One thing that I'm aware of and that I try to do is have an ongoing conversation about it, because things are constantly evolving. And I think, you know, the more that our kids are aware and in the know, the better they can manage and cope with all this change. So, you know, just try to have check-in points with them. When you have new information that's important for them to know, share that with them. And I also try myself and recommend for parents to be clear and concise and don't give too much jargon. They just sort of need to know high-level, age-appropriate information.
Yeah, when you say that, age appropriate, I see everybody's a different age. I think Max is 8. So you've got 8 to 3. And how do you know what's age appropriate? Because the seriousness of the pandemic, the way it could affect your family, how do you walk that fine line, especially if you've got people of different ages in your house?
Yeah, so in our house, I would say I have 2 separate conversations, one with the older 2 and then one with Charlie, the 3-year-old. With the 3-year-old, I focus more just talking about the changes that are affecting him personally. You know, we're not going to be going to school. We're going to be spending more time together as a family. We're going to be playing with your siblings. And I do also say, and the reason is because of something called the coronavirus. And I keep it kind of at that level. With my older 2, though, explain a little bit more about what the coronavirus is, how it spreads from one person to the other, and then also keeping them sort of up to date and informed about school and, you know, when it might start again, even though that's a hard thing to tell them, but also what we're going to do to maintain our schooling and sort of keep up to date.
And maybe one final piece of advice for parents then that are feeling super stressed because, you know, the kids get too much screen time and they're not getting outside as much. You know, they just feel there's a lot going on and they're trying to do their jobs and parenting, and really those are 2 separate jobs. What would you say to parents?
My number 1 tip is every morning have what we call the morning huddle, where we establish the plan for the day. And when you're establishing that plan, tell your kids, you know, when they're going to get screen time, when you need them to keep themselves busy because you have to be on a work call, when you're going to do something together as a family activity. The more information we give our kids, the better they'll cope and manage, because they'll be prepared and in the know.
All right, I'm going to put Max on the spot. How's your mom doing so far, do you think?
Good.
And how are you doing, Max? Are you bored yet, or how are you coping?
It's fun.
It's fun. You're not sick of your family yet?
Nope.
Oh, well, you're lucky. You're lucky. How about you, Louise? How are you coping? How are you doing?
Good.
Yeah?
What are you doing that's making it good?
Coloring.
Speak to her. Tell her what you're
Coloring and doing
Coloring.
crafts.
Yeah. Do you miss your friends, Louise?
Yeah.
Yeah, I hear you. Me too. All right, Karen, Max, Louise, and Charlie, thank you. I appreciate it. This is an important part of what's happening right now. Hang in there, you guys. Stay healthy.
Thank you. Okay, bye. Thanks.
Okay, take care. Thank you. It's good because everybody's coping with that kind of stuff at home. If you've got kids, it's good to know. Kids are pretty resilient, as you can see there from those 3. All right, I will be back a little bit later for coverage of the Queen's address and the words of it and advice that she plans to give people around the world. And we will, of course, be back here tomorrow for more coverage of how the federal government is fighting the COVID-19 pandemic. For now, though, Michael Serapio will continue our coverage in a few moments. I am Rosemary Barton. Thank you for watching. I'll see you tomorrow. Take care.